thanks for coming. Let's just go around the room real quick and introduce yourself just in case you don't know who everyone is. I'm Mark Garton, the sheriff here in Polk County.
Lyle Morris, Polk County Commissioner.
Sam Hiddle, I'm the office manager at Community Corrections.
John, I'm Agency Authority. Jeremy Gordon, Polk County Commissioner.
Jessica Fitz, community member.
David Shane, Dallas City Council. Bob Mason from Independence PD. Trevor Lefkey, Salem PD.
Eric Pelton, Polk TA.
Jody Merritt, Community Corrections Director.
Allison Kelly, Liberty House CDO.
Bob Simpson, Dallas PD.
Valentino Bañuelos, Independence PD.
Alicia Kim, Trial Court Administrator.
Michelle Spindler, Program Manager. Rebecca Shaw, Circuit Court Supervisor.
And on the phone, there's only 4 of you. Go for it.
Hi there. Apologies. We thought we had heard a rumor that it was all switching to in video, so that's why we didn't walk across the street to be there today.
Oh, that was Noelle Carroll. And this is Jennifer Leaf, Polk County Health Services Division Manager.
Hi, I'm Rochelle Juarez. I'm the acting executive director at Sable House.
Amber McClellan, Program Manager for Child Welfare.
All right, looks like we need minutes, approval of minutes for August. If anybody has read them and wants to make that motion. Perfect. Any other discussion or changes that need to be made? If not, all those in favor signify by saying aye. 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 Any opposed? Nope. Awesome. Crisis service, Jennifer. I think you're up.
I am Sam, I think I was going to put up my presentation. Is that right?
She's working on that right now.
Okay.
Can you see the screen, Jennifer?
I can see all of you. I can't see my presentation or if it's up yet.
Okay, can you see it?
Yeah, I can. Oops. Okay. And are you going to turn it for me or can I do that?
You can do it for me.
I can do it.
No, I think I have to do it.
Oh, okay. Okay. Okay, so today I'm going to provide a presentation about how to access crisis services in Polk County as things are shifting a little bit. Okay.
Sure.
So first I wanted to give you a little bit of clarification about new terminology. And so our mobile crisis services are called MCIS, Mobile Crisis Intervention Services, and that encompasses everything related to our mobile program, Mobile Crisis Response Program. MCIT, that's the new name of the Mobile Crisis Response Team, so Mobile Crisis Intervention Teams. So they're designated, anybody who's designated to that team has specialized training to serve individuals and different types of special populations of every age. And mobile response and stabilization services are stabilization services that are provided to individuals 20 years old or younger. And we can provide services up to 56 days, depending on the need of the individual. Okay. So I wanted to give you an idea of how the crisis system is shifting in our state. So the idea is that there's a person in crisis or a support person who needs support with a crisis situation, and they call 988 for services or for information. And typically in our county, 95% of all crisis calls that are received by 988 are resolved on the phone. And then others are resolved in various ways, whether it's calling 911, calling EMS, calling our mobile crisis team, or whomever. And then when mobile crisis and or law enforcement go out, then we resolve about 71% in the field, depending on what that looks like. 68% of folks who go into our crisis facility, which right now is Salem ED and PCC, are discharged back to the community, and 85% of the folks remain stable in community-based care. And so we do a 72-hour shift. So basically, we meet with the person in crisis and we do a risk assessment. And then depending on their needs, we provide some crisis support services and follow-up so that all those services are provided within 72 hours. We don't, well, I'll get to that part. So in all of our mobile crisis response is 72 hours or less. That's how we respond. So, okay, next. So I wanted to give you the Oregon Health Authority's vision so that you can understand system-wise where the state is headed. And their intention is for 988 to be the first place people go to behavioral health crisis services. Just like we call 911 for emergency situations or EMS, the goal is to have individuals who are having mental health issues or feeling suicidal or at risk or need emotional support to call 988. 988 in our location is Northwest Human Services, who have been our hotline callers for a long time. So they're really well versed in our resources and the things that we have in our community, Marion and Polk. So 988 will link the callers to local providers for a range of crisis care services, depending on what their need is. They link callers to tools and resources to help prevent future crisis situations. And people in crisis get the community-based care they need. They don't have to wait in ED departments or the jail. So it's just a different option, hopefully managing the situation better. Okay. I'm going to be sending out these slides to you after this too, or Sam will. So the 988 Suicide and Crisis Hotline is available 24/7 for people who are experiencing behavioral health crisis. They can call, and as of January 1st, they'll be able to text and chat online locally. So over at Northwest Human Services, where the 988 services are provided, I think they have about 14 or 15 crisis counselors who work over there, who have training and help. I think it's a 60-hour training on top of their current education. So that they can help people who have suicidal issues, substance use, or mental health crises, or any other kind of emotional distress. So people don't need to be contemplating suicide. If they just need emotional support, sometimes life feels unmanageable, things happen and people don't know where to turn or what to do. So they just need somebody to talk to. They can call 988. So below, as it says again, it just repeats mental health related distress, suicide or self-harm, and substance use crises. The phones are answered and available in English and Spanish, and they do have interpretive services for 250 languages, and they also use ALS, so they can connect people there. 988 also has a veterans line. So if you call 988 and then you press 1, you will get veteran services, so specific to individuals who would like services from somebody who understands veterans and military. Okay. So when do you contact 988? You call 911 when you or someone you know is in imminent danger. You call them, you get an automated response initially that says the options for vets or Spanish speaking services. and the person's connected to the counselor. And then it kind of gives you an overview right here. The person receives support, de-escalation, skills, resources, or follow-up from mobile crisis. If there's higher concern of risk to self or others, they get a wellness check from law enforcement, which may include a co-responding mobile crisis team. And the person, if they're at imminent risk of harm or of self to others, the person will receive emergency law enforcement response or medical response, which may or may not include MCIT. Depends on the situation. Okay, you can turn it. So these are kind of the three, or largely the two set of services we have. So mobile crisis intervention services are the ones that Polk County provides. So it's anyone reaching out to crisis. We accept any insurance type or no insurance, all ages, any location within our county, any diagnosis, and our length of service is limited to 72 hours. And we will have a 2-person response team. So youth and family require slightly different approaches. And so for youth and families, we have services for individuals 20 years old or younger and their family. And it begins with mobile crisis. So they have those initial mobile crisis response situations. We have a team that we only have one team. All of our staff have been trained working with kids, but we have one team that will specialize in kids, and they will respond as often as possible in the 72 hours, but there may be another mobile crisis team who responds initially and then hands off to our MRSS team. And the services can go up to 56 days, and it's care coordination, referrals, peer support for families, medication management, skills training, things of that nature, just coordinating those services and support to help stabilize the family. And they may do some of this work in their home as well, if that's needed. Okay. So how you access the services in Polk County. Initially, so this is where things are shifting. People used to just call us directly, and that number is still in service. I'm not saying it's not, but right now a person in crisis would call 988. So almost 95% of all contacts are resolved, like I said, by crisis hotline specialists. You don't have to be the person in crisis to use 988. Anybody can use 988. Family member, friend, etc., to support a person in crisis or seek that support for that person in crisis. Community partners may help their clients also by contacting 988, having the client contact 988, and sometimes the community partner would do that with the client, or the community partner can contact 988 for further assistance just to support their client in need. And then again, 988 will try to assist the family, community partner, individual to resolve the crisis at hand, depending on the situation. If they're not able or they feel there's a medical or safety risk, they'll reach out to Polk MCIT for a mobile or phone response. We don't always respond mobily. Sometimes they just want a more in-depth phone response and connection with services. EMS, if there's a medical emergency, and law enforcement, if there's safety risks. And then again, if law enforcement or EMS determine that a mobile crisis response is needed, they will contact us via our MCIT response hotline, which is answered by us 24/7, 365. And we get phone calls directly from 911, law enforcement, or EMS to determine what the next steps are with MCIT. And they can also call if they just need consultation. They don't necessarily have to have a mobile response, but it is a hotline for first responders to get a hold of us. Okay. So first responders include 911, 988, law enforcement, and emergency services. If they're seeking a mobile response, they contact MCIT on the dedicated response hotline for first responders. Like I said, it's open 24/7, 365. The MCIT dispatch, we have our internal dispatch, will gather information and then assign a team of 2 who will respond to the request. Right now, depending on staffing availability and services needed, some services may be triaged and have a later response. So, and if we don't have a team of 2 and the request is to go to an individual's home in the community, we don't have any information about that without support from one of the first responders, then we would review that for the scene safety and figure out if it's safe for our team of 2 to respond to that call or not. They can contact MCIT on the response line for consultation on the case if they have, and that's happened before. We've had them contact us, ask questions, ask for information, and then determine that they don't need us to respond, but they just wanted more information from mental health counselors. And also they can contact us on our hotline for non-urgent responses or follow-up. So if there's some sort of issue that they experienced that evening and they would like follow-up on, or something that they know that it's aware that's happening that they want to see if mobile crisis can help with, they can contact us there as well. And we just got this line up and running not too long ago, but we already are getting calls on this line, which is, it's nice to see. So okay. So I wanted to go over what we do and what we don't do. So what we do is we will send a 2-person response team if that's the decision that's made. We provide on-scene crisis services, de-escalation, assess for risk and safety at that site. We provide safety planning, stabilization services in the community. We coordinate services and support providers, and we provide follow-up for 72 hours after high-risk contacts. We also can do director's custodies for involuntary hospitalization if that's a need, and we do not charge for crisis response services. We do a lot more than that, but that's kind of the gist of it. What we don't do is we don't force engagement into services. So if we respond to somebody and they say, I'm not interested in services, or their family's not interested in services, that's okay. We don't do welfare checks. That's a law enforcement task. And so that's nothing that we do unless we were asked to accompany law enforcement for that situation. We don't transport individuals needing hospitalization to the ED right now. We don't provide ongoing therapy or case management, but we do coordinate care for that. We don't provide funds for hotel or short-term housing, and we don't respond to dangerous situations. So those are kind of some primary things that we don't do. And I think that's about it. Yeah. So if anybody has any questions, I'd be happy to answer them.
No question.
You did say we were going to get copies of the presentation.
Yeah, correct.
Yeah.
I think you're off the hook, Jennifer. Oh, never mind. Allison.
Sorry. Hi, Jennifer, this is Allison, Liberty House. Just great presentation. Thank you for that. I think I'm just kind of curious down the line, like maybe in 6 months or 12 months, it'll be interesting to learn about utilization data and, you know, just how many of the calls would involve. I'm interested in how many calls involve families with kids or older kids, things like that, kind of if there's any synergy with our mental health services and just overall.
We're working on that with our electronic health record, and as we modify the actual documentation that we use, we'll hopefully be gathering a lot of that data so that we can provide that to members of the community if needed, or just to help us shift the way we do things and how we respond.
And, you know, I guess just will that have made a difference for law enforcement, right?
I'm sorry, I didn't hear you.
Essentially that, well,
And,
yeah.
you know, I mean, from our law enforcement partners, like what difference that makes for them.
Yeah.
Just looking at it.
Anybody else? No, you were just for her. Okay. Awesome. Thanks, Jennifer.
Sure, I'm happy to answer any questions. I put my contact info on the presentation that you'll get. So if you have any questions, email me or call me. And if I don't know the answer, I'll try to help you figure it out. So thank you.
Awesome. Okay. In the agenda, you'll see the meeting dates for next year. And let's move into department reports, community corrections.
We don't have much to report. We have, one PO that is going to be graduating the academy on Friday, so we're excited to get him back into the office and start giving him cases so that we can get through our training. Other than that, we're just plugging along.
Courts, Unja, or
Courts have a lot of things going with the House Bill 2001, 4002, and a number of other things, but there's really not much of information right now to report on. Obviously, they deal with the set asides on landlord and tenant, recriminalization of certain drug offenses associated with deflection and what have you. But I actually wanted to introduce our new program manager for the Polk County Circuit Court's specialty court program, and her name is Rochelle Spindler. Rochelle is actually from Lynn County Mental Health, and she's been with us for what, a month now? And she's doing a great job. Thank you.
for the sheriff's office, we started our Woods deputy position again. It's not a general fund position. It's funded with timber company funds. Falls City, the city of Falls City is paying for some of it. And then the county's using some Title III money. I think it can only be used for certain types of things, and this does qualify. So it's outside of the general fund. Then we're helping behavioral health right now in terms of planning for training for their crisis teams when they go out into the public and how to deal with people maybe in volatile situations. So we're going to work on that training for them to get them what they need so they're safe. So that's all I have. Mr. Felton.
Sure. We are in a really good place in terms of our positions right now. We have basically only have one opening. We have an office specialist opening, which we're going to be having a hiring process starting next week. We're seeing people before, but we had our long-term office manager retire last week, and then our new office manager started officially this week, who was our former victims services director. She got promoted into the office manager position, and we were able to promote within one of our advocates into her position. And then we just had our new victim advocate start today. So we've had some transition, and we're all very excited to have those folks start their new slots. And then hopefully we'll get a new person into that office specialist position, which is a position at our front window, because the person, Michaela, who is at our front window, many folks know, she is moving into the office specialist position as a legal secretary. So that's exciting. And in terms of our many of our attorneys, we've been doing trainings. We had a very excellent training on homicides at the LPSSC. Dr. Steve Hinkle did that training. He is a long-term friend who's on the Point team for many years, but also is one of the senior guys at OSP for the major crimes team. Did a training that several of us went to at lunch right now, and for the rest of the afternoon, I've got several guys up in McMinnville doing a co-training with the Yamhill County District Attorney's Office. DOJ has been training Kurt Miller, their expert on search and seizure and all things related to that, is doing a training on search and seizure. So we were invited to join them. And so most of our team is up there, and I'm going to take courtroom 4 this afternoon at 1 o'clock so that our guys can get up there. And it's a good thing. We're seeing an uptick generally in intake from all of our law enforcement agencies in this last quarter. So we're starting to do a deep dive on, could be something, could be nothing, but it's always interesting to see what may be causing that in terms of resources, what's going on in the community. And so just maybe that folks are out getting at it, and positions are full across the community. And so people are doing what they're supposed to be doing out there in the field. So we're busy and looking forward to a good holiday season.
Commissioners.
Defense attorney.
There's no defense attorney here. So unless.
Okay, at this time, we don't have anything. Chair.
Noel, do you have any, or Jennifer, do you have anything that you want to share?
I don't have anything additional.
Okay.
I can share a couple things. As the sheriff said, we are working on training for our crisis folks, safety training, so on-scene training, situational awareness, things like that. So that's exciting. I just looked out our window today and saw walls going up on the new building that's out in front of our office. So that was nice to see that they're actually moving along with that. That will house crisis services as well as our burn services, which is Behavioral Health Resource Network and ACT. Then the other thing that I have one person currently over at Jody's office in community corrections, and she's providing jail diversion case management. So I feel like that's been going well. We've had a lot of referrals recently from the jail and from corrections. And so we just got a new mental health counselor as well who will be utilizing the space, and we have a peer who's working within that population as well. So I think that's a plus that's going on, and it's a needed services. So the case manager meets the individual prior to release or at corrections, and then helps connect them with services, whether it's treatment services, case management, whether they need a peer, et cetera. So just kind of not capturing, that's probably a bad word, just kind of catching them as they release from jail and as they first come into parole and probation, so that just so they have that support in the system and can be successful in their community. So.
Question.
Yeah.
Probably a stupid question, but I'll ask it anyway. Folks that are going into that new building, are those folks who are at one time contemplated being put in the old Wells Fargo building?
Did you hear that, Jennifer?
No, I didn't hear that. I'm sorry. It's a little muffled.
The Wells Fargo building, is that going to be essentially what you guys are building?
Oh,
on your
no.
space?
No, we don't have that building at all. This is in our location and on our property right by the academy. I don't know. The Wells Fargo building, I believe, was sold to.
Yeah, is it,
Somebody.
is it the same people that were going to be working out of there, or working out of the new building that you're building? It's just replacing it.
Oh, yeah, in a way, not exactly. I think things have shifted some, but to some degree, people in crisis can respond there, or people who need services from our behavioral health resource network. Yeah.
And so, it is not a facility like where we can, there's not beds or anything like that.
No.
It's
Well,
more-
I understand.
Okay.
that. I remember the whole debate that happened a couple of years ago. I just wondered if these were the same people or not.
Correct.
And just for a record, the people that will be receiving help there in the new building are currently receiving help in the academy building. So it's just
Correct.
a shift
Yeah.
out because we're just
Getting them
growing out of space.
Yes, that's especially the problem over here at the academy. It's been that way for a while. We just don't have enough space for all the services that we provide.
I understand about space. I'll get to that part. It's my turn.
All right, police departments, Tom?
Thanks, Sheriff. Just a couple things to cover on staffing. I hesitate to say this out loud, but we're fully staffed. I've got two recruits going through field training. One of them's been through the academy, just finishing up field training. The other one's a lateral from Tennessee, and he's gonna be going through his COD course online and finishing up his field training. So far, they seem to be working out well, so that's encouraging. The next big thing we're spending a lot of time on, a good portion of my time anyway, is our facilities project. As you may know, or have heard or read, the city bought the itemizer observer building, and we're working through plans with architects to design that space for a new police station. We've had one community meeting and got some feedback from the community on design input, things like this. Architects are working on some tentatively final design and cost estimates, and we're hoping to go back to the council the first part of December to talk about cost projections and things like this, after which we'll have another community meeting and go forward with a vision of potentially approaching a May 25 ballot for a bond measure if it goes to that point. So that's looking good. One thing we're doing as a part of that is tours of our existing facilities. We've got time set up. If anybody is interested, I encourage you to come take a look. We have, there's a place on our website where you can sign up for tours. We're offering them Wednesday afternoons, Wednesday evening, and once a month on Saturdays to give people a chance to walk through. The feedback we've received from those that have gone through so far has been surprising for most of them. The general public doesn't realize often how small all of our spaces are, whether it's mental health or your sheriff or whatever, but we're going to be continuing those tours up through right before the election in May if things continue that direction. So if you know of anybody that's interested and wants to walk through, just reach out on our webpage or give me a call. We'll get you scheduled for a tour. It takes about 15 minutes. It just gives folks an overview of why we're trying to make a change. Unless anyone has any questions for me. Thanks, Sheriff.
Sure. Yeah, election season, so that's, we're full force in the planning for that right now. Getting preparations made for the next couple of days, and we'll see what we see for that, but we've got our, crop patrol teams on standby, ready to go. And, if there's any protests or anything that we need to respond to, so, set, ready to go, working with OSP, FBI, coordinating, getting info, but as of right now, no credible threats, for anything for at least in the city so far. So, and where we're at, we're hiring along, waiting for the other shoe to drop, with our budget deficit, so we'll see as the, budget season progresses, where we're gonna end up on that. Okay. Independence.
Yeah, thanks, Sheriff. So, Tino Banuelos, back of the room, gonna be the next chief. Next meeting will be his, not mine. And then let's see, I wanted to thank Grant Ron. They hosted some active shooter training that we were able to send a lot of our staff to this past week, and heard good things about that. Tomorrow we are hosting an instructor development course for the new Milo system that LPSSC has acquired and is available to our agencies, but you have to go through the new training to use the new equipment. So we're gonna have that tomorrow at Independence. And that's it for me.
Tino, do you have anything?
Nothing more than I'm excited for the next meeting.
All right, city government. David.
Yeah, Tom covered beautifully most of what's gonna be of interest here. I'll just add one or two little tidbits. As he told you, we're hopefully gonna be finalizing the design for the new police station within the next month or so. And then the goal, the intention, all things being copacetic, which they seldom are, is to go to the voters in May. As everybody in this room knows, getting voters to fork over money is an uphill battle. And that's why those tours that Tom talked about are so important. The more people who can get in there and see how they're almost standing on each other's shoulders, the more people will go home and tell their 5 friends and hopefully generate enough. If there was wood here, I'd knock on it, but there isn't any. Hopefully generate enough understanding to allow us to be successful on that May ballot. So that's the main stuff that's going on. And yeah, and I'll just reiterate what Tom said. Encourage, if you live in anywhere near Dallas and get services from our police department, we encourage you to get your friends to sign up for one of those tours, because for the general public, it is eye-opening how crowded they really are in there.
All right, no OSP away. Anybody? Nobody from away?
Oh.
I thought it was you, but I was making sure.
Nothing to report.
Okay. CASA, nobody here from CASA. Department of Human Services, I think. Amber.
I don't have any updates.
Awesome, thank you. The Sable House, I don't know.
Sable House, we are currently hiring for 2 advocate case manager positions right now. One specifically is for a bilingual advocate. So we are understaffed right now. But we are maintaining services as normal and our shelter is currently full. We're at full capacity right now. And we do have funding available for rental assistance for families that are in need that we're working with, so. I think
That
that's it.
raises a question I'd like to ask. Since your shelter is full, what's the fallback when somebody comes to you and needs assistance and there's nowhere to put them?
If we can, we do have a little bit of funding to put people in hotels. Very temporarily while we help them find the next place that they can go at another shelter facility. And other resources in other areas, so.
Did I miss anybody?
Allison.
Oh, yeah.
Yeah.
We should just put you on our, not just other.
Yeah, no, hi, everybody. Good to see you. Liberty House, we are continuing to serve a lot of kids. We have a lot of availability. We're also in a pretty good position staffing wise. For anybody who may not know, we're not an agency, we're a private nonprofit. We're teams of trauma specialists and we provide specialized medical assessment for kids referred for abuse and neglect, trauma, grief, that kind of thing. We have both medical and mental health, and we participate on the Polk County multidisciplinary team, which is another group kind of like this, determined by statute. And typically, just so that you know, we see about 1,000 kids a year in our clinic alone, and we can do for either the bigger comprehensive full medical, full interview, those are the cases that may end up going to court, or just like an urgent care. We do urgent care type exams for kids referred for child abuse types of injuries. There's a law called Carly's Law that we're specifically supposed to give. So about 20% of our appointments are same day or next day, and we have that availability and we've been working toward doing that. So typically we see about between 150 and 200 children out of Polk County in any given year. So if there's anything we can do, we're in strategic planning mode right now. So it's pretty informal, you know, chiefs, if you soon to be chiefs, you know, please reach out if there's anything we can be, and I'll reach out to you too, if there's anything we can do differently or better for you. I will say so Liberty House is one of 24 of these children's advocacy centers in the state of Oregon, over 967 across the country. And they're regulated. Their quality is regulated by a group called the National Children's Alliance out of Washington, DC. And they publish standards of care. So they call them minimum standards they're very hefty. There are 10 published standards, 78 components overall. And since I joined the team at Liberty House 11 years ago, we've been working very hard for 11 years to be worthy of those standards. And even when a CAC serves 2 counties like we do, they only assess the MDT in the county where most of your staff is. So that's Marion. But anyway, we applied. After years and years of hard work, we applied last April and we had a site visit in mid-October. And we have been formally recommended for full accreditation to the NCA Board of Directors, and their board meets in January. So there will be a formal announcement coming. We can't really make it super formal because they have to put their stamp on it. But that's a really, really big deal. And we're just grateful for all of your partnership. You know, I think we're all in it for the kids. We were told that they were so impressed with us that we were among the top 5 of the 500 that these different site reviewers had reviewed in the course of their 20-year careers. We're in the top 5. So that felt really, really good. And, you know, so it's an honor to do what we do. And thank you for all your support. We wouldn't be here without, you know, all of you.
Oh, well done.
Thank you, John.
Yeah, so there will be more balloons and stuff later. Right now, the balloons are coming. I just want you all to know that.
Anything else for the good of the order? No? All right, next meeting, February 3rd, 2025, Bob, in case you're just interested.
You remember.